Jack Kevorkian, commonly known as Dr. Death, was born on May 26, 1928 and died on June 3, 2011. He aroused the controversial debate regarding assisted suicide of terminally ill patients. Resulting from multiple trials, Dr. Kevorkian served 8 years in jail for second-degree murder for administering the lethal injection. To get around the snag in his occupation, he began assisting the patients to inject themselves. A lot of controversy has risen from this case regarding the legality of it. Many people argue that he is guilty of murder. Some argue that he could essentially practice what he preaches. Mark Nolan at Blogs for Victory has stated, if he was in any way sincere about what he did, he would have hooked himself up to one of his infernal machines and offed himself when it became clear that there was no cure for his kidney and heart problem. But instead, he went to the hospital, which is where you go when you want someone, somehow, to keep you alive, because you know that life is precious, not something to be thrown away. In addition, many argue that it is not morally correct. God has put everyone on this planet for a reason, and he takes them off in his own time. Dr. Kevorkian does not allow for God to do his work in his own way. Even if someone is diagnosed with a terminally ill disease, there is no way of knowing definitely when his or her time will be up. There are plenty of cancer patients that live years and even decades after their initial diagnosis. Moreover, what if in that time there is some panacea discovered that could cure them? Ultimately, the fact of the matter is, you just don't know. There is no way of telling what could have happened, so interfering and giving up all hope does not fix anything, and it is not morally correct to do. In response, those negating his argument have said that all patients have wanted to die. That is the difference. They wanted to. Dr. Kevorkian did not want to die. He saw a purpose in his life and a chance at survival. He in fact denied 85% of all patients coming to him. The only ones he allowed were those terminally ill and that had no chance to live a happy lifestyle, the operative word being happy. Such people could not live a content lifestyle the way they would want to be, so it was essentially meaningless to them and not worth being alive. Moreover, Dr. Kevorkian noted that the majority of the population focuses on the part of the oath he took as a doctor to keep his patients alive. However, he does not believe that is the best way to do things. The oath also refers to helping patients. If he must help them kill themselves in order to aid them in ending their never-ending pain and suffering, he views that as helping them to do the best in his ability. He uses his ability to diagnose them, and if he agrees that they will never live the lifestyle they want, he helps them the only way he knows how. Ultimately, as a result, physician-assisted suicide is now illegal, but as to whether or not everyone agrees with it is up for debate. It is more of a moral issue at this point that will never be agreed on, but is nonetheless illegal.